Do you want to become a talk show host? Do you have a great idea? Passionate World Talk Radio is currently looking for podcast hosts for our Internet Talk radio station. Please email us at pwrnetworkllc@gmail.com with your name, email address, cell phone number, and podcast topic. In return, you will receive a 3-minute intro on air to a live audience about your podcast. Remember, just email us your name, email address, and your podcast topic, and in return, you will receive a free 3-minute intro on the air. How cool is that? Welcome to Passionate World Talk Radio. Educate, enlighten, entertain.
Hi, everybody. This is Betsy Wurzel, host of Chatting with Betsy on Passionate World Talk Radio Network, where we educate, enlighten, and entertain. The opinions and views of the guests may not represent those of the host or that of the station. Folks, you're going to want to listen to this podcast. Do you have Parkinson's disease? Do you have anyone in your family who has it? Or do you know someone? You're going to want to listen to this podcast. And even if you do not have a member of your family with Parkinson's, you need to listen to this podcast to find out about Parkinson's and what you can do to get the word out about it and to tell our representatives we need funding to stop this disease. Am I passionate? Yes, I am. And April is Parkinson's Disease Awareness Month, which I didn't realize, but every day, and I do mean every day, we should be raising awareness on Parkinson's disease and other diseases. It's not just a month. Those who live it every day, 24/7. It's for you, the public, to be made aware. And I want to talk about, this is what the podcast is about, this book, A Prescription for Action, Ending Parkinson's Disease. Mind-boggling, eye-opening. I suggest everyone to get it. It really opened up my eyes, and I appreciate the 2 authors that are here with me. There's Ford that wrote this book. I have Dr. Ray Dorsey with me and Dr. Michael Okun with me today. The other 2 authors are Dr. Todd, probably going to pronounce it wrong, Sherer, and Bastiaan Bloem. They also contributed in writing this book. So I want to thank Dr. Ray Dorsey for coming on and Dr. Michael Okun. How are you both?
Doing great,
Pleasure.
Betsy. Thank you very much for inviting us, and thank you for all you do for the caregiving community.
Oh, you're welcome. It's my pleasure. Dr. Ray, would you like to go first and tell a little bit about yourself?
Sure, Betsy. So I'm a neurologist at the University of Rochester, where I specialize in the care of individuals with Parkinson's disease, and was delighted to write this book on the world's fastest-growing brain disease with my colleagues Michael, Todd, and Bas.
And Dr. Okun, could you please tell us about yourself?
Sure, it'd be my pleasure. It's great. First, it's great to be here. Love the show. And
thank you.
It's just great to get the word out and impact as many people as we can. I'm a neurologist. I work at the University of Florida. I wear several hats. One is as chair of the Department of Neurology. I also direct an institute called the Norman Fiksel Institute for Neurological Diseases, which is an all-under-one roof shop for people with Parkinson's and other diseases and for research. And I'm the National Medical Advisor for the Parkinson's Foundation since 2006. And we have 47 centers of excellence all over the globe.
Well, I'm very honored, and I feel privileged to have you both on my show. I thought this book was really eye-opening to me. Not real familiar, a little familiar with Parkinson's disease, only because they thought my husband might have had Parkinson's, but he didn't. And to read that it could be environmental just was mind-blowing. And when you talked about the pesticides, and I am 63, so I grew up in the 60s, and I remember the mosquito trucks coming around and spraying whatever they sprayed, riding right into it. And, back then we didn't have air conditioning, so we went right into the house. And that made me think of that. So how much do you think the environment, such as pesticides, causes Parkinson's?
Well, we've known for a long time, Betsy, that environmental factors are the predominant factor for Parkinson's disease. 100 years ago, a neurologist named William Gowers wrote a series of people with Parkinson's disease, and he remarked that 15% of his patients had a family history of the disease, but that means that 85% didn't. And then 20 years ago, Dr. Carly Tanner, a great researcher in San Francisco, did a twin study that looked at the rates of Parkinson's disease among identical and fraternal twins and found it to be similar, which suggested that environmental risk factors are the predominant factor for Parkinson's disease. And although we know some genetic causes are important for about 15% of individuals, numerous studies have linked certain environmental risk factors, including pesticides, air pollution, and this industrial chemical called trichloroethylene, to Parkinson's disease. And some of these pesticides that were being sprayed by that truck when you were a child, some of those pesticides are nerve toxins. Some damage the parts of cells that we know are injured in Parkinson's disease. And some of those pesticides, when they're fed to laboratory animals, reproduce the features of Parkinson's disease. So we need to stop the indiscriminate use of some of these pesticides, and we need to ban some of the most harmful ones altogether.
And Dr. Okun, what is your viewpoint?
Yeah, so I think it's really important for people who are listening to realize that even the best of us, and I include myself in this group, for the last couple of decades, there's been skepticism about the environment and different diseases. And I do think it's up to the scientists to prove that there is causation. And, 20 years ago, both Ray and I, would have been, skeptical. But, in science, when we see the same finding come up over and over from multiple groups on multiple continents, and we see the bets, which in science we call odds ratios, kind of the bet of what might happen when we look at the statistics. When folks are exposed to things like paraquat and trichloroethylate, the statistics are, really high. They're off the roof that there's, a much higher risk of a later association of coming down with Parkinson. And so I think that it's time for us to take notice, to really, embrace the idea that we're seeing replication in the science, and to get busy trying to figure it out. And as Ray always says, to clean up. Let's ban these chemicals that we know are bad players.
That was really interesting to me. I mean, as a child living in New Jersey, I thought the factories made the clouds. And in reading your book, my husband, he had early onset Alzheimer's, but he had very much characteristics of somebody with Parkinson's, but he did have that, I think it's called a data scan, which was negative. But my husband worked for a chemical company. And when he came home, I mean, his clothes really stunk. And I'm wondering, could that have caused something? But I love in your book how you just encourage people to band together to write to, the legislators, the senators, the president. You had the Mail the Red Card back in March. And to be active, just like they found a treatment for AIDS, and how the women with breast cancer and the men got together. People who have Parkinson's and other diseases need to, I say, come out of their closet and say, here we are, we're not going anywhere, and we want a cure. We want you to stop these pesticides, and we want a cure like yesterday. And I love that part of your book where you encourage people, because I'm an activist myself. I have to ask you both this question because it's just a personal question that I need to ask. Why do some people who have Parkinson's develop Lewy body dementia and some don't?
We'll get
I don't know if there's an answer.
Yeah.
I don't know if there's an answer to that, but I'm just curious.
Yeah, it's a great question. And, just for, a little bit of context for people who are listening, when we talk about Lewy body disease and Parkinson's disease, the reason that we use that term Lewy, L-E-W-Y, is it's named after a neurologist and neuroscientist named Frederick Lewy that under the microscope looked and saw these proteins that deposited in the brains of people with Parkinson. And in fact, these are what we call pathognomonic, and that's a mouthful, but it means that's one of the signs we like to see for a diagnosis of Parkinson if we are looking at your brain after you die. Obviously, don't turn your brains in if you're not done with them. But when you're done with them, if you want to turn them into science, we find these things called Lewy bodies. And so Parkinson's disease, regular garden variety Parkinson disease that responds to dopamine, the disease that's very prevalent, the one that Ray is saying is the most rapidly growing disease, neurologic disease on the planet, they deposit these proteins called Lewy bodies. But then there's another disease made famous recently by the actor-comedian Robin Williams, where you get deposits of the same protein called a Lewy body that has something called alpha-synuclein in it. And it's probably way too much information for this audience. But having said that, it is where it is deposited in the brain. And so if we see those deposits in the first couple of years after your diagnosis in areas of the brain that are important to thinking, we call that cognition, to memory, and maybe to causing things like seeing certain illusions and hallucinations that aren't there, if you're affecting those brain systems, we tend to call it Lewy body dementia or Lewy body disease when you see that early. If you see that later on, which you can see later in the course of Parkinson, you can involve those same regions of the brain with the same Lewy bodies, these deposits of abnormal proteins. If you see it later on in the disease, 10 years on or more, just for example, then we call it Parkinson's disease. So there's this debate as to whether or not these two are the same disease, and just on different spectrums as to where the action is happening in the brain. Because fundamentally, where we see these abnormalities in the brain predicts the types of dysfunction. So if we see them deep in the brain in a substance called the black substance, in Latin called substantia nigra, those are the cells that have dopamine, then people might get shaking and stiffness and slowness, and that might be the typical thing that you're thinking about with Parkinson's. But if we see those proteins deposit up in other areas of the brain, up in the cerebral cortex, causing these hallucinations and memory dysfunctions, if we see that in the first couple of years, we may call that Lewy body disease. But they seem to be in the same family. And I will just say that the longer I practice medicine, the less I know. It is a very humbling profession, and getting a handle on what's going on with these types of diseases and their spectrum is still a bit of a moving target, although I think we know more now than we did even 5 or 10 years ago.
Yes, I definitely agree with you. I also have to ask this question because I am an advocate for people who have any kind of dementia. My husband had early onset. So as you know that, Alzheimer's is one of the dementias. Okay, under Parkinson's disease, are there varieties of other diseases under that Parkinson's umbrella?
Yes, so there are many different causes of dementia, Alzheimer's disease being the most common, and then there are many different kinds of Parkinsonian disorders that are associated with slowness, difficulty moving, and Parkinson's disease is the most common of those. There are other Parkinsonian disorders. Sometimes people get something that looks like Parkinson's disease from taking certain medications, especially antipsychotics. Some people get it from this diffuse Lewy body disease that Dr. Okun was just describing. Some get it with some rare disorders. They're rare, so we give them initials: MSA, multiple systems atrophy, or PSP, progressive supranuclear palsy. I think the big thing to realize is that these things are common. There's about 5.8 million Americans who have Alzheimer's disease and about 1.2 million Americans who have Parkinson's disease. So together, that's 7 million Americans have either Parkinson's or Alzheimer's. Said another way, 1 out of every 50 Americans has Parkinson's disease or Alzheimer's disease today. And if we don't think about better ways of caring for people with the disease, better ways of treating people with those diseases, and better ways of preventing those diseases, we're all going to be affected by them.
Absolutely. I agree 100%. And what would you recommend, Dr. Ray and Dr. Michael, about when someone thinks they might have Parkinson's or think their spouse or partner might have it? What should they do? Should they go to a neurologist? Should they go to a special center that could be around in the area? Should they even begin?
Michael, you want to go?
Yeah. So this is something that we talk about quite a lot with the Parkinson's Centers of Excellence. And the reality on the ground is something that's a bit embarrassing, to share with your listeners, but it's that we don't have enough Parkinson's specialists and we don't have enough neurologists. And worldwide and even in the United States, Allison Willis at the University of Pennsylvania even did a study. Even if you saw a neurologist one time, your outcomes are so much better with Parkinson than not. And so seeing a neurologist is important. But, even more than that, this is a complex disorder. And it has been termed the most complex disorder in medicine when you consider there are over 20 motor features like stiffness, slowness, shuffling when you walk, and then these non-motor features, depression, anxiety, apathy, and then you give dopamine and they get better. And then as you treat the people, they go through these fluctuations where they're better and they're worse throughout the day and throughout their medication cycles. And then there's surgery. So you get the idea here. The complexity of not only diagnosis and treatment is so high that we recommend that if you can at least try to get to a neurologist, that would be first. Second, if you could get to a center of excellence, and so the Parkinson's Foundation has 47 centers of excellence all around the country, or someone that trained in Parkinson, and we only train 40 neurologists in Parkinson a year in the United States. It's pitiful. And there's no funding. Like for cardiologists, we train them with Medicare funding, and liver doctors and kidney doctors and heart doctors. We don't do that for Alzheimer's and Parkinson doctors. So if you can get to one of these types of specialty centers, even better. They're oftentimes at universities. If you cannot get to a specialty center, sometimes you can do it through tele, and the best treatment is, we believe, multidisciplinary or interdisciplinary, where you have a neurologist, a neurosurgeon, a neuropsychologist, a psychiatrist, physical, occupational, speech, swallow, social work, nutrition, etc., all under the same roof and offering care in the same place and access to clinical trials. And that is very rare. Like we have that at the University of Florida. Ray has that at Rochester. These are two centers of excellence. That is not the case everywhere on the planet.
Are there clinical trials for Parkinson's?
Yes, there are lots of them. Listeners can go to clinicaltrials.gov or to Fox Trial Finder, and they can find references, lots of ways to find out to participate in clinical trials. They can also look in our book, Ending Parkinson's Disease. We have pages at the back which provide resources. So there are numerous clinical trials being conducted right now, and numerous therapies in development, both medical, surgical, and even exercise treatments that are being evaluated to help people with Parkinson's disease in the very near future.
Thank you. That's one thing. Another highlight of your book is that you do list a lot of resources that will help people and direct them.
Yeah,
so I really like that about your book. Dr. Ray, what would you like to tell the audience of why they should buy this book? What do you want them to take away from it? And then I'll ask Dr. Okun the same question.
Well, first of all, if they can't afford to buy the book, we'll send them one for free. They just email us at info@endingpd.org. Any of your listeners can't afford a copy of the book, we'll be delighted to send them one for free, info@endingpd.org. Just give us your mailing address so we can mail one to you. And all the authors are donating all of our proceeds to efforts to end Parkinson's disease, and they can purchase the book on Amazon or whatever their favorite book retailer is. You know, I wrote the book because Parkinson's disease is the world's fastest growing brain disease, and I think we can prevent a lot of cases of Parkinson's disease. I mean, you said at the outset that certain pesticides have been linked to Parkinson's disease, increase the risk by 150% or more. And, you know, bad things happen to people, but when bad things happen to people that are preventable, we should take action and prevent people from ever developing these diseases in the first place. We've done this in the past. We did that with polio in the 1930s, 40s, and 50s. We've done that with HIV in the 80s and 90s. We're trying to do that. Mothers Against Drunk Driving did that in the 80s and 90s and prevented, you know, thousands of us from ever having to deal with the tragedy of a drunk driving accident. If we do the same for Parkinson's disease, our generation can be the generation that prevents thousands, if not millions, of people in the future from ever developing this debilitating disease to begin with.
Thank you. Dr. Okun?
Yes, so I think that, you know, for me personally, I've spent my career in both seeing persons with diseases like Parkinson's. I have a research laboratory, and, you know, it's become evident to me over the past several decades that we need to do as much as we can to impact people's lives. And when we look at these, you know, somewhat explosive numbers, we had a meeting with the World Health Organization last week, and it's all over the planet and just getting worse and worse. This is going to cause so much suffering for so many people and could collapse healthcare systems with billions of dollars of spending. It's just, you know, it's no longer an issue of, you know, should we do something? It's how fast can we do something to try to get a hold of this. And when we wrote the book, for me, Ray and I in particular worked on the message. And in looking at other diseases, if you want to end a disease, we studied polio and we studied HIV. And those in particular had a great influence on our thinking. And we came up with this acronym called the PACT, P-A-C-T, Prevent, Advocate, Care, and Develop New Research Treatments. And so for me, just, you know, understanding that we have to not only care for the people that have it, not only prevent people from getting it, but also we have to double down on our research efforts. We're only putting $200 million of NIH funding a year into Parkinson, and, you know, that might sound like a lot to people, but it's not. HIV, it took $3 billion a year of National Institutes of Health funding to change the trajectory of the disease. So we're well under 10 times where we need to be. So we sent 25,000 cards to the White House. You can get a card at endingpd.org, and we're passionate not only about the book, and I'm passionate about this message. You know, we need to ban these chemicals that we know are associated with Parkinson. We need to make sure that telemedicine sticks around so we can bring care to the home, and that's not permanent. That's only temporary right now with COVID-19. So that needs to be made permanent, and we need to increase research funding by tenfold. So to me, if we can get a grassroots movement, and you said you're an advocate, a grassroots kind of person, an activist, I think was the term that you used, we've got to get enough people together to tip what Malcolm Gladwell would call the tip, to get to a tipping point. And so there is a grassroots group called the PD Avengers that you can tweet them, or you can tweet me or Ray, and we can get you in contact with them. There's now thousands of people that are now speaking up and speaking out, and that's what we're going to need. We're going to need that kind of grassroots activism to really change the trajectory of Parkinson. That's why it was an honor to write this book with these other three gentlemen.
Well, thank you. I thank you, Dr. Okun, Dr. Dorsey, for what you are doing and what you will be doing and writing this book. And I just want to encourage people out there, show your journey. Show your loved one with Parkinson's. Show it on your Facebook, and do not care what people think. I showed my husband's journey. So I encourage people to speak up and stand up. I do have a question before we end, and with reading your book and about the pesticides, and I was thinking, as you had mentioned about Vietnam and Agent Orange, do you see a more like an increase in the Vietnam vets compared to other veterans with an increase in Parkinson's?
We certainly see higher rates of the disease among veterans. So there's 1.2 million Americans who have Parkinson's disease. 1 out of every 10 of them is a veteran. 1 out of every 10 people with Parkinson's disease is a veteran. And veterans are at higher risk because they're exposed to pesticides like Agent Orange. They're exposed to chemicals like trichloroethylene, widely used in degreasing. Things contaminated the marine base Camp Lejeune in North Carolina, exposing up to 1 million people with TCE contaminated drinking water that they were bathing in, water that they were washing their children with. And then veterans are at higher risk for head trauma, which increases the risk of Parkinson's disease. So veterans, because of their service, pay a disproportionate burden of the disease because of pesticide exposure, because of exposure to degreasing chemicals like trichloroethylene, and because of head trauma.
Well, thank you. Thank you so much. I want to tell the audience, people think, I can't make a difference. I can't speak up. Yes, you can. It takes one person to make a difference, one person to light that candle, and we can make a difference. We need to hound our people in government for a cure and to stop these pesticides. And I want to encourage everyone to go on the website. If you can't afford the book, to buy it, they will send it to you for free. It's called Ending Parkinson's Disease. I highly recommend it. And I want to thank Dr. Dorsey again, Dr. Okun again for what you do, and thank you for coming on Chatting with Betsy. And thank you so much. I feel very honored. I want to thank Jeannie White, station manager, Passionate World Talk Radio Network, who produces the show, writes the blog. Please read the blog. It will have information. And I want to thank Lowland Caldwell, CEO of Passionate World Talk Radio Network. Folks, in a world where you could be anything, be kind. And you know what? Be active and be compassionate. Nobody knows what it's like until you had that disease. And you know what, folks? Before my husband was diagnosed, okay, my mother-in-law had Alzheimer's, but, I just thought, she's older. It can affect any age. Parkinson's affects people that are young also. Don't have the attitude, I'm immune to it, or not my monkey, not my circus, not my backyard. Because nobody, and I mean nobody, is immune to Parkinson's or any type of dementia. It can come to your family, and then what are you going to do? This is why we need to all be involved and to speak up. And yes, I do get on my soapbox, and yes, I am very passionate. You can hear it in my voice. I'm almost in tears. Because it just affected my family, Alzheimer's. But, when they thought my husband had Parkinson's, it was like, mind-blowing to me. So, yes, Parkinson's does touch my heart because I thought my husband at one point had it. So please be involved. And please just, love up on a caregiver, too, while I'm at it, because you don't know what it's like to give care to somebody 24/7. So thank you for listening, everybody. I appreciate it. If you missed any of this podcast, you can hear it on your favorite podcast outlet. It's free to subscribe. I'm on Speaker, Spotify, Apple, just to name just a few. And I encourage you all to share this podcast to help other people. That's what this Chatting with Betsy is all about. So thank you again. And have a good day, everybody. Until we chat again, be blessed. This is Betsy Wurzel, host of Chatting with Betsy at Passionate World Talk Radio Network. Bye-bye, everybody.
Do you want to become a talk show host? Do you have a great idea? Passionate World Talk Radio is currently looking for podcast hosts for our Internet Talk radio station. Please email us at pwrnetworkllc@gmail.com with your name, email address, cell phone number, and podcast topic. In return, you will receive a 3-minute intro on air to a live audience about your podcast. Remember, just email us your name, email address, and your podcast topic, and in return, you will receive a free 3-minute intro on the air. How cool is that? Thank you for listening to Passionate World Talk Radio. You can listen to this program all over again by going over to https://passionateworldtalkradio.com. You can also hear it on Spotify, Spreaker, Amazon Alexa, AMFM247.com every Tuesday evening between 8 and 9 p.m. YouTube, Facebook Live, LinkedIn, and all the other podcast directories one can find on the Internet.